I'm going to be presenting information about our college. I'll go ahead and get started or keep going. All right. So, as David mentioned, my name is Jesus Ramirez. Also, I decided to provide a photo of y'all of David so you can see him there as well. We are both academic advisors in our Office of Student Success within the College of Public Health and Human Sciences. There are currently 9 advisors. And a little bit of information about me. I am a alum of Oregon State University, so I'm a diehard Beaver fan. I graduated with a degree in human development and family sciences with a option in human services, and and so I graduated in 2010, and then from there, I went on and did my master's degree in college counseling and student development, and then came back to work at Oregon State. And so when I came back to Oregon State, I served as a resident director for 3.5 years. So I know a good amount of information about university housing and dining services at Oregon State as well. So if you have questions about that, feel free to ask at the end. So I did that for about 3.5 years, and then in 2017, I became an academic advisor for the college that I absolutely love on our campus, and the college that I got my degree from. And so I've been doing that for almost 3 years, and so I'm really looking forward to talking to you all about our college. All right. So to begin with, our College of Public Health and Human Sciences. Oh, and by the way, we use the acronym either CPHHS or PHHS, so you'll see that a lot. So our college has 4 different majors, and those 4 majors are in 2 different schools. So I'll talk about the first school being the School of Social and Behavioral Health Sciences. So within that school, we have public health as a major, and the 2 options within public health are health management and policy and health promotion and health behavior. And then we also have human development and family sciences. And within human development and family sciences, there are 3 different options. We have the general option, the child development option, and then human services. And then in the second school, which is called the School of Biological and Population Health Sciences, we have nutrition, and nutrition has 3 different options: either dietetics, nutrition and food service systems, and nutrition and health sciences. And then the last major, but actually the biggest major in our college, is kinesiology. And within kinesiology, you have the option of declaring what's called the pre-therapy and allied health sciences. So, and I'll talk more in depth about uh, what it means to declare an option within these 4 different majors. All right, so the first major that we're going to talk about is public health. And public health generally is basically the study of social and individual determinants of health. So, like, really thinking about what factors contribute to helping people be healthy, and thinking about that from the physical perspective, or social, intellectual, emotional, all those different aspects of health. Um, that's kind of really what public health is looking at, is how to create programs that help people be well and healthy, and live as long of a life as possible. And so within public health, there are 2 options: health promotion, health behavior, being the one that I'm talking about now. Within this option, basically, students are learning a lot about how to create and or evaluate programs that address public health issues. And so Students learn a lot about disease and how diseases spread. So they learn a lot about epidemiology, and um, students also learn a lot about how the environment impacts individuals or communities. Um, and, um, and students are ultimately learning how to um, create these types of programs, evaluate these type of programs, and make sure that they're sustainable in the long run. And so, so this is the health promotion, health behavior option. Students gain skills in needs assessment. So really looking at what are the needs in a community, thinking about um, different factors like gender, race, and there's really a focus on disparities in communities. So really looking at what are those things that we need to address to make sure that community people are healthy. Also program development, conflict resolution, and crisis management. All right. The second option within public health is health management and policy. And health management policy takes more of an administrative approach to public health. So, whereas health promotion, health behavior is literally looking at the education piece, health management policy is looking more at the back end of things. So, how to deliver and finance public health programs. Typically, these types of careers are in hospitals. So really looking at units within a hospital or healthcare programs at hospitals, and really how to manage them, how to improve their systems or processes, um, how to improve quality healthcare, basically, right? Within this option, students take classes in health management, healthcare law and regulation, financial management of healthcare organizations, marketing and accounting. So this option is very robust. It has lots of um, business courses that students can take as a way to also learn the business and administrative aspect of healthcare management. So this is a great option if you're thinking of um, working in this type of industry where it's very administrative and um, you're basically improving healthcare for folks. All right. And so within both of these options, there are opportunities to get experience. Um, and through internships. So with both options, students are required to do an internship. The internship is a 12 credit internship. And the way the internship works is you work with advisors as well as with our undergraduate internship coordinator to look for an internship that interests you so that you can learn a little bit more about the public health field. Um, and once you um, kind of figure out which places you are interested in, basically reach out to those organizations and see if there's internships available. And and then while you're doing the internship at the site, you're also taking a class that kind of gets you to look at and reflect on your experiences and how you are fulfilling the competencies needed for public health professionals. So, a lot of our students get internships in a lot of different areas. They'll work for like government agencies or for nonprofit organizations. We have students who are interested in becoming nurses and do public health major with health promotion, health behavior, and decide to work at clinics um, to shadow and get that type of experience. Um, excuse me. Um, Yeah, so we've had students get internships at places like OHSU, at Providence, at Kaiser Permanente, and a lot of different hospitals, and just a lot of different places. I actually just worked with a student who got an internship for this summer for Marquis Company, which does long-term care facility um, for folks in the Portland area. And even though there's stuff going on, currently with pandemic and whatnot, the student is able to do his internship remotely. So we're really excited about that and happy for him to be doing that. Um, and you get credit for the internship. So that's kind of how the internship works. All right, so the next major I will talk about is kinesiology. So kinesiology is basically the study of human movement and the human body, and we study the human body through physical activity and exercise, and really thinking about social emotional health with all of that. Um, so a lot of our students in this major take courses that are very like science heavy. They take things like chemistry, anatomy and physiology, applied muscle physiology, tissue and injury repair, fitness assessment. So really learning a lot anatomically about the human body, learning a lot about how it performs, how to heal the body, how to make it stronger. Um, so things like that. Our students in this major gain skills in physical performance assessment. They learn a lot about rehabilitative activity and design, as well as athletic observation skills. Within the kinesiology major, there is the option to declare what we call the pre-therapy and allied health option. Um, And this is a great option for students who are interested in pursuing a professional degree after their undergraduate degree, especially for the occupations listed here on the left side. So students within the pre-therapy and allied health option uh, take courses um, specific to their track. So if they're interested in athletic training, then they take some specific courses like a physical assessment and design for that. Or if they're interested in physical therapy, then they take classes like therapeutic modalities or exercise modalities. We also have occupational therapy, we have nursing, pre-physician assistant, and also pre-medicine. So if you're interested in any of those pre-professional tracks, the pre-therapy and allied health option is great. A huge benefit of this option is that there's a lot of professional development that's offered. We actually have instructors who work with students to match them to clinics, to be able to get observation hours uh, at clinics. So it's a really great opportunity. In order for students to declare this option, we do have a couple of requirements within this, within as a kinesiology major. The first being that students have to have 90 credits or be at junior standing. Um, Also, students have to have a 3.0 GPA, and that's calculated with OSU as well as anything that you transfer in. So if you're taking dual college credits, or if you are taking credits at a community college while you're at OSU, we count the GPA, the average GPA of both. And then also, students have to obtain a 2.7 GPA or a B minus average in the anatomy and physiology series. And the reason for these requirements is that a lot of these professional programs at the graduate level require that students complete prerequisite courses with these grades. And so we just pretty much want to help set students up for success in that process of transitioning from their undergraduate degrees to their graduate programs. And within kinesiology, students are able to do what we call experiential learning, which is basically any experiences that gets you to apply what you're learning in the classroom and the knowledge that you're gaining in the real world. So like Students are able to do a practicum or internship or special projects or research. And the really cool thing about Oregon State University is that we are a land grant, a land, sea, space, and sun grant university. So we have a ton of research that renowned faculty members are working on. And so our students have opportunities to do a lot of really cool research. In kinesiology, for example, we have a human performance lab. We also have a a bioskeletal lab. And then we also have a neuromechanics lab, so where students are able to kind of work with faculty on different projects within those areas. And then in terms of the practicums and internships, a lot of students work with our faculty to observe licensed physicians to be able to get the hours that they need to apply to graduate programs. We also have some really cool special projects that I'll talk about later in this presentation. So a lot of great opportunities to get some experience. All right, so moving on to the third major. So human development and family sciences has three different options. The first option I'll talk about is the child development option. So child development is basically focusing on how children develop and really thinking about how they develop biologically, socially, intellectually, emotionally, all those ways, and then how to facilitate learning given all of that. Um, so if you're thinking about a career where you really like to work with children, this is a great option for that. We see all types of students declare this option in this major. Everything from folks who want to be um, like preschool teachers or elementary school teachers to people who want to be pediatric physicians or doctors, and everything in between. So a lot of a lot of different careers that you could go into with this child development option. Students take classes in infant and child development, family, school, community collaboration, and fostering learning in early childhood. Like those are some of the classes that students take. And then what's really cool about the child development option is that it culminates into what we call um, the child development internship. So we have a Head Start program on campus where community members have their kids at, and our students in the child development option have the opportunity to work with the Head Start teachers to be their assistant teachers in that class. And so it's a 12 credit internship that students do typically in their senior or junior year. So it's a great opportunity for students to develop skills in classroom design and management, child and family intervention. There's a lot of so students in that internship get to do parent-teacher conferences, and so it's an opportunity for students to talk with the parents about how the kids are doing in the class, just how their behavior is, how they're interacting with kids. Um, really great major and option. All right, so the next option in HDFS is human services. Human services really focuses on how to improve human condition or circumstances through programs, resources, or services, or even education. So this is a really great option for people who are looking into social work or counseling or working for like nonprofit organizations or other organizations that want to serve certain populations of people. So within this option, students take classes in human service skills for human services professionals, really learning how to manage caseloads and administratively, and how to be thinking about different human needs. Students are also taking classes in family studies and learning about the family structure and what that looks like and how that contributes to the development of people. Also taking adult development and aging. So, what is aging all about? What are the things that come with aging? Very interesting information. So yeah, students basically gain skills in strength-based counseling, crisis management, and family resource referral. All right. And then the last option within HDFS is the general option. So if you're not set on child development or not completely set on human services, but want the general HDFS major, this is a great option for those individuals. So this is the only option in our college that doesn't require an internship. And I think the reason for that is just so that individuals, aren't completely required to do an internship in a certain area. Students have the option of doing that if they would like. Um, so basically, with this option, students will typically minor in other subjects or other areas to kind of help supplement their interests in a certain career. But yeah, students will take classes in program development, proposal writing, adolescent development, family structure in the U.S., and also gain skills in resource analysis, community service management, and family resource referral. All right, so with HDFS, as with the other majors, there are internships as well. I talked a lot about the child development option internship that we have. We also, the human services option requires a practicum, a 4 credit practicum where you get 90 hours of experience at a site. Um, Dedicated to providing people with services. um, and oftentimes I get the question of like, what's the difference between practicum and an internship? Basically, a practicum, you have less responsibility being at a site, more so like volunteering and observing and learning a lot about the mission, values, and goals of an organization. Whereas with an internship, it's longer hours, and so you typically have a little bit more responsibility. Depending on the organization, they might give you more tasks and have you do things independently, um, and so to be able to get more experience. Let's see. Human services internships have been things like being working for CASA, which is Court Appointed Special Advocates. I have had students work for, let's see, do internships. I have a student who did an internship, or she did her practicum at the Corvallis ABC House, which is a place that takes in children, and they run forensics on children who have been in abusive situations, to be able to determine where those children can be placed. Um, so yeah, and she really enjoyed her practicum, so much so that she is now doing her internship there. Well, actually, she won't do her internship until fall, given all the stuff that's going on. But that's kind of where she's gonna be doing her internship as well. So, all right. So the last major I'll talk about is nutrition. So with nutrition, there are 3 different options, and the first I'll talk about is pre-dietetics. So um, our dietetics program is one of the best programs here in Oregon to go on to become a registered dietitian. Um, so nutrition really is looking at learning about food and the human body and how food impacts our bodies in a lot of ways, like and not just biologically, but also thinking about how it impacts the choices that people make when they eat foods, or how people react to certain foods or don't react to other foods. And so that's kind of the approach that dietetics takes, is really learning about that to be able to help design meal plans or meal programs for people. So Um, so that's the pre-dietetics option. The reason why it's pre-dietetics is because so you start off as pre-dietetics, take a few courses that are required, and then by the end of your sophomore year, you apply for the dietetics program, or excuse me, the uh, dietetic the didactic program in dietetics. Sorry, uh, it's also known as DPD. And so basically, once you complete the pre-dietetics course requirements and you apply to get into the full dietetics program, then you're in a cohort of people who you take classes with for the remaining 2 years. And so um, students take classes in community nutrition, management of food systems, labs, managing food and nutrition services, and even like biochemistry. Students gain skills in nutrition and diet assessment, organizational management and budgeting, and research planning and production. All right, so the next option within nutrition is nutrition and health sciences. So this option is for those individuals who are very much interested in the research aspect of nutrition. So really looking at a chemical molecular level, how food impacts our health, looking at how it impacts chronic diseases and things like that. And so because it's very much a research type of option, students take a lot of science courses in this option. They take things like general chemistry, organic chemistry, biochemistry. They take principles of biology. Um, a lot of science classes. They take even anatomy and physiology, medical nutrition therapy, a lot of different courses to really get a good understanding scientifically of how nutrition works in the human body. Um, and this tends to be a really great option for people who want to go into becoming physicians. Uh, so a lot of pre-med majors who are interested in the nutrition aspect of medicine will elect this option. And then the last option within nutrition is nutrition and food service systems. So if you're interested in kind of learning more about how food impacts the restaurant industry or kind of blending food with business, really thinking about maybe um, how to design your own restaurant with nutritious foods, the kind of whole farm to table industry. This is a really great option. Within this option, students will learn some of the basic information about nutrition, um, and also learn a lot about the business of food and marketing and how to manage food service organizations. Additionally, students in this option take 1 year of culinary courses at our partnering community college, which is Lynn Benton Community College. We help students figure out how to make this work within their schedule, and students love it because they kind of get that hands-on experience, that culinary experience, also along with the business aspect of food service systems. So, really great option if you are thinking about running a restaurant. Within the nutrition major, there are internships that students could do as well. I talked about um, so I talked about the dietetics option within nutrition. The dietetics option in nutrition is unique in that um, this option is the way for students to become registered dietitians. In order to become a registered dietitian, students have to complete a dietetics internship through a graduate program. So either through a master's or or a PhD type of program. Um, and so our students at the end of their nutrition program take a seminar course to learn and get more information about how to prepare for applying for those graduate programs, and the whole process of matching with a dietetics internship and master's program. Um, and then there are also other field experience opportunities for like students who declare the nutrition health sciences option. They can do research. We have the Moore Family Center, uh, which is one of our research centers on campus, where they study different kinds of foods. They do food and diet study labs. And so our students are able to get experience through that type of research. All right, so some other opportunities that students can get involved with in our college. We have some programs, some really cool programs that are part of our adapted physical activities master's program. And so some of those programs are Impact. Impact is so it stands for Individualized Movement Physical Activity for Children Today. So it's a program where we work with children who have disabilities and basically create like a physical activity program with them. And so some of our students work with children once a week to like go like walking or to go swimming or to play games to kind of work on their motor movements. And so really great way to get to work um, with folks who have who learn differently physically. And so so that's Impact. We also have Go Baby Go, which is a great program. Basically we have faculty who work on recreating little cars for kids ages from birth to 3 years old. They basically modify these cars so that kids are able to ride them and utilize their motor skills as well, and develop those as they're getting older. So a lot of cool programs that our students can be a part of to get experience and then to have that count as credit within their major. And then another great opportunity is the Honors College. So if you're a student who loves academics and are a high achieving student, you might have already also applied for the Honors College. Um, if you haven't, that's okay. You could also apply for to be in the Honors College while you're at OSU. But Honors College is a really great way to, or being part of the Honors College is a great way to work with faculty on a thesis that you complete by the time you graduate from OSU. And you can share that thesis with future employers. And so I've had a few different students that I've worked with that were part of the Honors College as well as our college, and basically work with faculty from our department to be able to do their thesis. I worked with a student who did a thesis on the kindergarten readiness research program in our college. So really looking at what types of factors contribute to kids being ready to enter kindergarten. Um, so yeah, really cool things, really cool research opportunities that our students are involved in. There's also opportunities to study abroad. So we have different types of study abroad programs. Um, we have what are called faculty-led programs. So if you're interested in a study abroad program that is more structured, and you go with a faculty member, and you take a class, or you basically get credits for classes there, and they have different activities planned out for you while you're there, and you kind of stay with the entire group for the most part. Um, So that's what the faculty-led programs are. We also have internships that you can do abroad. So, again, if you're looking to study abroad and get some experience while you're doing it, we have a lot of students that do their public health internships abroad, working for organizations that do global public health type of work. Um, or even just public health work in their countries or in their towns. We have students that go on and do that as well. Just a lot of great opportunities to study abroad in different ways. And then I also talked a lot about research. We are really big on research at OSU. And there's different ways that you can get involved in that. You could do it formally through programs, through the university or through our college. Or if you're just in a classroom and you hear your instructor talk about research that they're working on, you can connect with them afterwards to see how you can be involved in that research. We have some other really cool opportunities that you can be involved in. We have clubs and organizations. I really want to encourage y'all to join a club or an organization as you go to college. I think this is a great way to make friends, to build your networks, your social networks on campus. You also gain leadership skills and experience. I've had students who've been involved in some of these clubs who were able to get an internship through going to a workshop or a session and connecting with someone and making it go from there. I actually went to a workshop from the Pre-Therapy and Allied Health Club, our PETA Club. They brought in admission representatives from Pacific University to talk about the admissions process to get into Pacific University. So, like their PA program and their PT and OT programs. And I learned a lot about their process, and a lot of other students also learned about that. So a lot of great ways to get professional development and to network. So definitely want to encourage that. These are some of the programs that we have: the HDFS Student Club, the Healthy Aging Club, the Society of Healthcare Administrators, Society of Healthcare Executives. Um, and you don't have to be in any specific major to be in any of those clubs. You can be, as long as you have an interest and want to learn more, you can be in any of these clubs. And these are just the clubs that are part of our college. There are a lot more clubs and organizations through OSU. I think OSU has something like 300 plus student organizations. Um, so yeah, there's that. All right. So one of the questions that we often get from students is, where do students go after they graduate with their degree in public health or in kinesiology? And we've had students go a lot of different places. Some of these they're all mentioned here. Um, we have students that go on and work for OHSU, for Kaiser Permanente, or the Center for Disease Control and Prevention. We have students that go and work for North Lake Physical Therapy and Rehabilitation. We also have some students that just go on to graduate school and professional programs there. Um, yeah, a lot of opportunities to go a lot of different places. And you'll hear a little bit later, one of our alums shared some advice that she had about kind of taking advantage of opportunities in our college. Oh, so I guess that's my next slide. So we asked one of our alums. This is Rebecca Chavez. She is an outreach specialist for Polk County Public Health, and she shared that what she really enjoyed about being, a public health major in the college was the practicality of applying material learned in the classroom to real life situations in the field. She also went on to say that she recommends taking any opportunity to gain experience inside and outside of the classroom, and that in public health, the possibilities are endless. And so, she went through the program, she was really involved, and, is now, working as a professional. She actually received an award from the Oregon Public Health Association as an emerging professional leader in the field, which is why we decided to highlight her. All right, so that concludes my presentation.